vision and its importance with reading. What we do know about vision is that 75 to 80% of learning is through the visual system, so it definitely plays a big role in the overall learning process. And the number of children with vision problems that are affecting their ability to learn is 1 in 4. So it's not an insignificant problem. However, it is often widely undiagnosed. How do we define good vision? I think always when we're talking about vision problems, it's a good idea to talk about what, how do we define that? What is good vision? And again, some of the answers I'm going to answer tonight, or questions I'm going to answer tonight, is what visual skills are required for efficient reading. And that's what I'm specifically going to hone in on, although vision can affect other skills such as handwriting and math as well. So what does 20/20 vision mean? Because often when we think of good vision, the word 20/20 pops up into our head. That's basically a distance measure of what someone can see 20 feet away. So that's the first 20 is 20 feet. And the second 20 has to do with the size of the letter make. So it's an angle size. So the E, the big E on the eye chart is 2200. As you go down, it looks like 2100. You keep going down, this is 2040. That's usually what you're required to have when you drive. And then 20/20 is what most people can see, so they can see this size target 20 feet away. So it is primarily distance measurement, although you can convert it into a near measurement as well. But the problem is one of most visual screening tools use the 20/20 eye chart to measure whether or not a child has good vision, and unfortunately, that's really not the whole story when it comes to good visual skills. So this child here has 20/20 vision, but he struggles in school. So I'm going to, hopefully that's coming through okay. It might be a little spotty just because of the internet connection. But one of the things that we look at is that, for instance, this child, when he crosses over the middle, like by his nose, he starts to have some difficulty over time. And then now we've got one eye covered here, that frosted lens you can't really see out of. And he's just kind of tracking and following the ball. But what you can see as we kind of go along here is that the tracking and following the ball becomes harder. And becomes more work right there. So the 20/20 eye test isn't going to pick up this type of vision problem, which is what I'm going to talk about more today. So if 20/20 vision isn't the only visual skill that's required for reading, and it's not maybe even the most important one required for reading, because a lot of nearsighted people actually tend to be very good readers. What is important? So today we're going to talk about some of those skills. We're going to talk, not necessarily in this order, we're going to talk about eye teaming, which is using both eyes together, focusing skills, tracking skills, and then we're going to talk about briefly talk about some of the visual perceptual, what we call visual perceptual skills that can interfere with reading fluency, which includes visual form discrimination, visual memory, and laterality directionality skills. So first, let's talk about eye tracking. So I'm going to show another video of another child. And he's, again, tracking the ball. So there I told him not to move his head and see what happened. And he shows a little bit of fatigue with that as well. Now I'm going to have him just follow the ball into his nose. This is one test a lot of eye doctors will do to check convergence. It's not always the most accurate test for checking convergence, and we'll talk about convergence in a little bit. So now I'm going to have a look between two different color balls. One is gold and one is silver. So I'm telling him gold, silver, gold, silver, gold, silver. All right. Hold on a second. I'm just going to try to fix my screen here because my GoToMeeting app disappeared for a second. Yeah. So one of the things, I'll just talk and play it again. So one of the things that you'll notice is that he has a lot of head movement. So that means that he hasn't learned really how to track and follow with his eyes independently from his head. And that skill is usually getting towards being mastered, usually around 7 or 8. They'll have a lot less head movement. They might just have a little bit. And by 9 or 10, it pretty much goes away, and they can accurately do this test without any head movement at all. You see, even if I ask him not to move his head, he becomes much less accurate with being able to track and follow the ball. So what happens, and it's especially true when I ask him to go between the gold and silver balls, and what you'll see is a lot of head movement. Well, if you're moving your head instead of your eyes when you're reading, you aren't going to be able to accurately follow a chapter book very well, because you're going to lose your place a lot, because your eye movements are much more accurate than your head movements can be. So kids that have poor eye tracking skills tend to, most common symptom we see is losing their place when they read. Focusing skills. So when you talk about focusing skills, what we're talking about is that when light enters into the eye, there's a lens behind the iris, the blue part here, that helps to focus light on the retina. And that lens is controlled by some muscles called the ciliary body, which are kind of at each end of it, all the way around. And when your eyes focus on something up close, those muscles have to do some work to get things clear. And when they look far away, they're going to relax to see things clearly far away. So focusing skills are basically very important for keeping things clear. But they relax when you look far away. So again, it's not going to always affect your distance vision, although it can. If, for instance, a child is working really hard up close to get things clear up close, you can get what's called a spasm, where you have difficulty and it doesn't release as easily to see far away. But most of the time, it'll be more of a near problem, so that the child will have difficulty focusing things up close. Now, adults get this similar problems with this system when they get to about age 40, but that's because that lens itself gets harder and stiffer and harder to move. And so that's why adults need to go to reading glasses or bifocals around that age. It's a different problem in kids. While focusing skills are usually well developed by age 4 to 6 months, so it's also not an issue where they, still have to wait for their eyes to develop. That happens fairly early on. So we expect that system to be working fairly well pretty early in life. And when it's not working well, then it can cause blurry vision, because again, the eyes aren't quite focusing where they should. It's going to cause blurry vision, or it can cause some difficulty with eye strain and headaches. Or what we're going to talk about is more often, I see kids struggling with attention for reading because it's hard work. The other visual skill that can cause sometimes similar symptoms is called eye teaming. And what I mean by eye teaming is using both eyes together as a team. Let me just check here. For some reason, it doesn't want to let me keep that GoToMeeting app up. Okay. So two eyes have to create one picture. Both eyes have to point in the same place at the same time. So the picture down below shows a little boy who's doing what we call converging. Both eyes are coming into the target as you get closer, and then they go out again when you look farther away. This is also what gives us 3D vision or depth perception. So sometimes people with eye teaming problems will not like 3D movies. They'll either get headaches or sick or not. If it's really severe, they might not be able to appreciate the 3D. The most common type of convergence or eye teaming problems that we see are called convergence insufficiency and or convergence excess. So what I mean by that is you have the two eyes pointing on the page. If they don't quite point exactly at the page but point a little bit beyond and line up a little beyond the page, that's called convergence insufficiency because the eyes aren't quite converging enough. If they focus in front of the page, that's called convergence excess. Both can create similar symptoms, although we treat them differently in therapy. If both eyes aren't pointing in the same place at the same time, it can cause double vision. And the smaller something is, the more the print can double. Not all kids complain of double vision. Sometimes it only happens periodically or as the eyes tire. So again, if they give up before they get to that point, then you're not always going to see double vision. Sometimes it can cause that eye strain and headaches as well. Sometimes the print gets a little blurry, and sometimes it can just look like it's moving around the page. And that says the eyes alternate which eye wants to be dominant and take over. All of this can significantly slow down the reading speed or reduce comprehension. So if we go back to the first little boy where we were showing how he was tracking, when he has trouble right there at the midline, that's actually his eyes having trouble converging, using both eyes together and converging. So the eye teaming skills are more affected there. And then when we get to where we're covering an eye, which I think is going to happen, and you can see there's a fatigue factor that goes on. So it started out okay, but as we kept going, it definitely got a lot worse. We're talking about muscle coordination issues here, so fatigue can definitely be a factor. Whereas there, left eye wasn't so bad with the focusing, but the right eye is where he really struggles with the focusing system. And maybe it's because it was the eye that was done second, or maybe that eye is actually just not working as well as the other one, because he has to work really hard to keep it. So, and he was a really hard worker for that. So you can see blink, 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 trying to refocus his eyes. So I like to show this one. This one's really hard to look at, but this is an example of how double vision can look. So it can look like things are just kind of running together, but you can kind of see the double. Oftentimes it's like one image will not be as dark as the other image. Here's some other examples of how things can look when you have eye teaming and eye focusing issues. So you can have where, again, down in the bottom where it's just kind of run together. Sometimes they describe kind of wavy print. This is more like blurry and double, blurry vision. Again, this is if they keep with it. There's this fatigue that can happen, and how well they can compensate for their eye teaming problems will often determine how long they can study or do near work before this starts to happen. I should say occasionally sometimes we'll have a patient who doesn't have any of these symptoms, but they end up kind of really learned to shut off an eye. And so they're really only reading with one eye rather than both eyes. Or sometimes what happens is they switch which eye they read with as they go along. And if you're switching which eye you're reading with and not really reading with both eyes, that will actually look like an eye tracking issue where you'll get a lot of losing your place on the page, missing lines, that sort of thing. Okay. And so those are kind of the three, what I call the three basic visual skills, and they're often, oftentimes you'll see problems in all three areas because they kind of develop together. I should say eye teaming is another skill that's developed fairly early on, usually about 6 months of age. It's fairly accurate. It's not something you expect to see in a toddler or older. So it's not like, oh, they just need to wait until those skills come in. It's not like that sort of fine motor skill. We do expect those systems, the focusing and the teaming, are working well at a fairly young age. And sometimes it's a case where they just never develop the skills, and sometimes it's a case where something interfered with skills that they already had as they went along. One of the most common causes of developing these type of problems later in life, like when they're not, let's say it's not a developmental issue where they just never developed the skills, is head injuries and concussions. And that could be a whole lecture in and of itself. So the other area, so what we've talked about so far is kind of more like the visual input. So you have to have clear vision. It has to be single vision that has to work efficiently, and then you have to be able to track your eyes from one place to another accurately. Those are all what I call input skills, so how well you can get the input in. Visual perception is more about the output. So once it's in your brain, once it's gotten into the visual system and goes to those higher level areas, how does the brain process that information? So it's really about bringing meaning to what we see. If eyesight is, well, I use the analogy, if hearing is, hearing and listening are not exactly the same, well, eyesight and vision, again, are not exactly the same. So some areas that we commonly see difficulty with that can interfere with reading, one of the big ones I'd say especially in that 7 to 8, 9-year-old range tends to be directional skills. And what I mean by that is understanding directional concepts such as right and left. One of the things that they commonly see when a child has difficulty with this is that they'll reverse a lot of letters. Now, the letter reversals at age 5, 6, not a big deal. 7, maybe start to get a little concerned, but if it's only like B's and D's and it's only some of the time, not too concerned. But once you get to 8 years old or around second grade, you expect those to kind of go away. And part of the reason is that that one skill is a developmental sequence that kids go through. So usually around age 5, they're just starting to really understand, this is my right hand, this is my left hand, and that there's directions to things. Reading is, unique to some other things with direction, in that we always read from left to right in English, right? So if you have trouble understanding directional concepts, you might flip words over or you might flip letters over. Because up until that point, you take a pen, you turn it on its side, you turn it up. It doesn't matter which way you turn it, it's still a pen. But they have to understand those concepts of right and left to kind of reduce the number of letter reversals. So usually about age 5, they're just kind of getting the hang of that stuff. So if you still see some, then it's all right. Usually the concepts of right and left directional skills from a developmental standpoint start to just solidify around age 8. That's why that kind of becomes a crucial age, where we tend to say, nah, you really shouldn't be seeing a lot of them by age 8. And then they're at the adult level by usually age 9 or 10. So again, if you have a lot of confusion with right and left, you're more likely to see some letter reversals. Another area that's really important that can be, the development of this skill can kind of be interfered with if you have input problems, so focusing and convergence problems, but that's the skill called visual discrimination. That's basically being able to notice the details, being being able to notice similarities and differences. So if you see two words that kind of look alike, you're able to notice that they're slightly different. Even if it's, for instance, bed versus bad is, one letter difference, but changes the complete meaning of what you're trying to read. So a lot of times those don't develop if the other input areas are not developing properly, but that's also a skill that can be worked in and of itself. And then visual figure ground, that's really important for finding the relevant information. Sometimes it's an issue when there's a lot of crowding on a page, being able to find what you're looking at versus blending in with the background. Another area that's really big for reading is the skill of visualization, and that's basically being able to make pictures in your head is the best way to describe that. So kids who do a lot of imaginative play often are pretty good at visualizing, and so I like to encourage that type of play because that can often help with that making pictures in your head. But sometimes they just never learn that skill. So some of the things that we look at with that, if we break down visualization, there's a visual memory part. So just remembering what you saw. And so that would be that, and visual sequential memory is remembering things in a sequence. So both of those are important for reading. If you were to, one of the ways we test this is we flash a design and they have to find it on the next page by memory. But it's important for reading because it's all about remembering what the word looks like. And it's very important for writing and for spelling because there you're going completely off your visual picture of the word oftentimes for writing out the word. And so many words cannot be sounded out that it's important to have quick recall of words, especially, for instance, we always talk about the sight words because those can't be sounded out. But even with words that do have, can be phonetically spelled, if you're going to read them quickly, you still have to have a mental picture of what that word looks like, somewhere stored in your memory. And then, so oftentimes kids with poor visual memory you'll show them a word and then maybe it's on the next page or further down in the sentence, and they'll still forget what that word is. Now, sometimes there's input problems, such as the focusing and teaming that interfere that make it hard to remember because they're putting all their energy into making their eyes work to see things clearly. But sometimes that's another skill that needs to be developed in order to make it more automatic. And then another kind of filling in with visualization is also a skill that we work on a lot, which is called visual closure. So that, again, relates to quicker recall of words. If you imagine our brain actually recognizes the shape of the word before it actually recognizes the word. And it happens very quickly. But if you're able to kind of fill in what comes next or understand or have a quicker recognition of the word, then you're going to be more fluent reader. Visualization also is important for comprehension. If you can visualize what is being read, you're more likely to remember it later on. So it becomes a skill not only for early readers, but also for older readers who are working on maybe a complex process, and they have to kind of visualize in their head how that process goes from a string of words, which is more sequential. It helps if they can get a visual picture of the what is being said for a better comprehension. Sorry, I'm losing my voice. Okay, so we'll keep going here. So let's talk a little bit more about what a vision and learning problem or a vision and reading problem might look like, just to kind of summarize everything. So eye strain, eye rubbing, that can be certainly an issue. Oh, one thing I didn't talk about. One way is that sometimes kids compensate for a eye teaming issue or difficulty using both eyes together is they'll actually cover an eye. So you might see them cover an eye. You might see them tilt their head or turn their head. You might see them actually, it looks like they're just being lazy, but they might actually get really close to the page or kind of slump over to one side. Oftentimes that can be a compensation for not being able to use both eyes together. They might get really tired. So oftentimes parents get hit the hardest because when are they wanting to do their extra, homework and work on more on the reading skills, is go home and do it. But oftentimes it's the worst time for the child because they're the most exhausted if they're doing it at the end of the day, because they've spent a whole day doing school work and near-point work, and now to do some extra. So sometimes it can help if you move the reading to a little bit earlier, maybe not wait last thing before bed, because that's going to probably be their worst time to work on reading when it comes from as far as the vision goes. So they might be abnormally tired, they might get headaches, or have more eye strain symptoms. But oftentimes they just get frustrated, and that's where sometimes you can see more behavioral issues or inattention, what looks like inattention issues. So they just they literally can't focus their eyes on their page, so they don't focus. Visual focus is very important for, in general, maintaining your attention on something. So, but behavioral issues can also be a big issue, especially, again, more for the parents. They get really frustrated. Again, they're usually working on these things their worst time of night. So there's the fatigue factor, and it just gets hard. So those are some of the things that we can see. One of the new diagnostic tools that we just acquired last month is called the Readalyzer. This can tell us a lot about what is happening when they're reading. So you'll see this picture of the child with the goggles on is actually an instrument that measures eye movements as they read. So he's reading a paragraph. It's taking some measurements. It actually takes it from the right and the left eye, so we can look at how well they're working together. And especially looks at how what they do with their eyes. So you expect a good reader is going to have kind of a pattern, like a stereotype pattern, where their eyes jump from one word to the next, and when it goes to the next line, it's going to go back again, and goes to the next line, it's going to go back again. So kind of like, that typewriter effect, but in the visograph reading, it'll look like the stair step. Poor readers don't have that nice stair step. Oftentimes things will look like this. So they might, rather than going forward, their eyes might jump backwards, or there's not a real pattern to it. But you see a lot of what we call regressions, where the eyes kind of go backwards. They might have to either reread things, or they might have to find their place again. Here is an example of how it can kind of help me from a diagnostic standpoint, kind of rule out what's what. So in this example, I have a child who actually has poor eye teaming skills, or difficulty using both eyes together, but he's actually on par for his reading. So he's going into 3rd grade, and he's reading. His grade level equivalent is 3rd grade, and what that's talking about is how fast he can read, although his reading was slightly slow. How regression, so did his eyes move backward? He's got pretty good eye movement skills. He kept going forward as he went along. But what he didn't have, what he had a lot of difficulty with was this, what we call cross-correlation number, which relates to what the right and left eye is doing. So here, I think that's the right eye, basically kind of like was not following, and then this is the left eye. And you got some nice stair step there. And, this is grade normed because, we expect it to be different for an adult reader versus a young reader, and we also expect It can analyze it based on their grade, but we also have different paragraphs that we can give them. Usually I just stay within what their reading level is, because if you get something too hard, then it doesn't really tell us very much. But that's an example of where the more eye teaming. And this boy, he does have more of the attention issues. Even though he's a really good reader, he has more attentional issues. It probably shows up a little bit more in the writing and in the math skills. But again, he can compensate for his poor eye teaming problem because he's a good reader. Sometimes complains of headaches and eye strain, that sort of thing. So here's an example of someone that's different, that has good eye teaming skills. They were 99% of the time the eyes were working together, which usually we like 90% or above, but has poor eye movements and poor reading skills. So here, this person had eyes went backward a lot, so they work together, but this person needs to work a lot more on their eye movement, tracking skills, and isn't having a lot of eye teaming issues. Although I have to say that this was halfway through therapy, and those eye teaming issues have gotten a lot better. If I had this in the beginning of therapy, it would have been a little bit different story. But this person also needs to work more on quicker decoding. Still needs it's probably still going to need some tutoring in reading, and extra help in reading. And again, I'd like to work more with her on the visual quicker recognition of words, because she spent a lot of time looking at words and figuring out what they were, quite above what she should. So that would be the fixations over on the left-hand side. And again, her eyes went backwards a lot, so she needs to work a lot more on the tracking. So let me just make sure. So some of the common symptoms, just to again reiterate: poor fluency, skips lines when reading, trouble remembering what was read, comprehension, slow reading speed. That's because the eyes might have to focus or take longer to focus on each word. Double vision, blurriness, words moving around the page, eye strain, fatigue, headaches, poor attention to near work or reading, or avoidance behaviors or behavioral issues, especially in regards to the academics. And those, I should say, that symptom list actually came from a National Institute of Health study, which is kind of considered the gold standard study when you look at any sort of medical study. These are the symptoms that they say are most commonly associated with, especially the convergence problems. Some other things from this related study by the NIH is that children labeled with ADD or ADHD are 3 times more likely to have convergence problems. And then also they did a follow-up study as part of a study they were doing about the effectiveness of vision therapy, and they found the successful treatment of convergence problems resulted in a significant improvement of academic behaviors as measured by this academic behavior survey. Which brings us to what can be done to improve these visual skills. So vision therapy is a progressive, individualized program designed to remediate and enhance visual skills and visual information processing difficulties. It can look like many different things depending on what we're working on. A lot of working on tracking with the one eye and both eyes. A lot of what we do involves lenses, though. So lenses that might change the focusing system, lenses that kind of help vary the input between the right and the left eye and create 3D pictures that we can then use to increase that convergence demand. Excuse me. Lenses that we can do things with while they're doing some motor skills activities. Lenses are what really make it different from, let's say, what you might do with an occupational therapist. Doctors who provide vision therapy tend to be board certified in this area, and they usually have the initials FCVOD after their name. We went to go back to what we were talking about before with the eye chart, the 20/20 vision. Most of the eye exams that you get either from optometrists or ophthalmologists are kind of geared towards that 20/20 on the eye chart. So unless they do the extra testing, which optometrists are more likely to do because it's more part of their training, unless they do the special test, they may not actually find that these sort of vision problems in a comprehensive eye exam. Sometimes it's because they're not asking the right questions, but oftentimes it's because they're also not doing the right sort of testing to identify them. Typically, the reason why ophthalmologists don't do that sort of testing is because they do get their training as surgeons, and so they don't get as much training in the functional aspects of vision, and they often do not provide vision therapy or get any training in vision therapy. That being said, every optometry school, and optometrists are the ODs, not ophthalmologists are the MDs. Every optometry school does teach vision therapy as part of the training. Again, it doesn't necessarily mean that every optometrist includes that type of testing in their comprehensive exam. And oftentimes, even though I do have optometrists to refer to me, oftentimes it does take specialized training beyond what we get in our general optometry courses to actually get good at finding these cases and knowing how to treat them. Some other facts from the National Institute of Health study. What is, a lot of people want to know what's the success rate with vision therapy. So in this study, they only did 12 weeks of vision therapy that included in-office visits and a home program. And 75% of patients with convergence problems showed a significant improvement in their symptoms and their findings after just 12 weeks. Oftentimes, my program will usually go longer than that just to make sure that the patient is solid. And again, oftentimes we're also working on maybe focusing issues as well as those eye tracking and perceptual issues. So my typical treatment program is usually somewhere between 20 to 30 sessions depending on the severity of the issues. Patients with another study showed that as far as the focusing problems that we're talking about, 87% of patients with accommodative or focusing difficulties were successfully treated with vision therapy. So that is also a very high rate, and that was also after 12 weeks of vision therapy. A lot of vision therapy is kind of, I use the riding a bike analogy. We've got to get it to the point where it just happens automatically, and the brain just does what it's supposed to. The coordination is there. The patient doesn't have to think about it. So that's where sometimes I go a little bit longer treatment plan to ensure that that happens. The worst thing is, when I try not to get anybody in that 25%. So I think our success rate here is a little bit higher than that because we go a little bit longer with our therapy. There also is a new study that will be coming out soon that looks at the eye tracking to see what the success rate is for that. So we know there's a correlation between poor reading and eye tracking. The initial study showed that, but we don't have the results for before and after vision therapy yet. Although there are other studies, again, I didn't include them because they're not the National Institute of Health study, which again is the gold standard when it comes to medical studies. So I'm going to talk a little bit about things that can be done at home or in school to kind of help with some of these reading problems that are related to eye problems. So one of the things that I often do recommend is a slant board. Basically, it's a tilted board. So the hardest thing on your eyes is when it's on a flat surface. It helps if it's tilted up a little bit. If you think about it, when you read a book or magazine, you almost always tilt it a little bit so that it's more at an incline. That's because that's much easier for your eyes than having it flat. So if you're working at a table or something, you might want to use what we call a slant board or place the book on a 2-inch binder. Sometimes those aren't sturdy enough, and we do sell some more sturdier slant boards that are better for writing, as well as you can put your book on it and things here in our office. Excuse me. Another way to help is to try to avoid what we call visual confusion. So here I showed more the math problems, but when there's too much on a page, that can be really hard when you have these visual problems such as the teaming, tracking, and focusing. So one of the things you can do is either increase the spacing between the lines of problems or decrease the amount of visual information on the page. So maybe one way to decrease the visual information on a page is to take a blank sheet of paper and then just block off all but what you're trying to look at. And then you can move the paper down as you go between lines of print, or you can, if you're doing a worksheet like this, you could present one line at a time. Sometimes they even use like more of a window where you have both the top and the bottom blocked off. That's another way that can help. Increase the print size and contrast. So you really don't want a low contrast. Oftentimes if you have, well, I say that, however, oftentimes it's hard for a patient because of the glare on a stark white piece of paper. So sometimes that more creamish type of paper colored paper is a little bit easier than, say, a really bright white paper when the print is on it. Even though it's high contrast, they get more glare. But you don't want to use something that has really low contrast either. And then working what we call elbow to knuckle distance, which is called Harmon's distance after the person that did the research on that. So you want to try not to get too close to the page. So the distance between your elbow to knuckle is kind of the ideal distance you want to be. So again, if you're doing work at a table, you know, bar stools can sometimes be an issue because you're maybe either too high or too low, or even sometimes the kitchen table can be hard. You just want to try to figure out a way so that they can work at that distance. You don't want them too close or too far away. Allow short breaks. That helps with the visual fatigue. So you might do 10 minutes of something, get up, move around. You might want it to be a structured break. So maybe you, if they like balls, maybe you throw the ball around for 5 minutes, or let them do something a little more active. Avoid Scantron type tests. Those are for obviously the older patients who maybe are taking those sort of tests for the standardized test. Filling in the bubbles, finding the right bubble can be really difficult. And then, of course, be evaluated for vision and learning problems by an optometrist. So those are often ways to help. I didn't include it on here, but I've also been doing more recommendation of, there's certain apps that are kind of designed for speed readers. Most of them are designed for older readers to work on their reading speed. But there's two things that they do. Either they have like a moving window where it's a small window and their eyes have to track along as they read. That can be good for increasing reading speed once the visual skills are in place. There's also apps that kind of flash words and then quickly, so that you have to know the word quickly. That kind of works on more the visual memory. You can kind of recreate this by doing some flashcards where you flash a word and then the child has to say the word. So you start with words they kind of know, and then you increase the difficulty of the word. You try to get it to a point where it's just more automatic. That's one way to work on some of the visual memory skills that can be an issue, or when they have difficulty recognizing a word quickly. So that was it. There's more information that you may find on the website. I do often post interesting things on Facebook, so if you're a Facebook member, you can check us out there. I think it's just if you search New Horizons Vision Therapy Center, it should come up. A few other websites, COVD, that's the board certification organization for Dr. Tsuji Vision Therapy. They have a lot of good information. PAVEvision.org is a parents group. PAVE stands for Parents Active in Vision Education. Optometrist.org has quite a few different, lots of information about not only vision and learning problems, but other visual issues that are treated with vision therapy. And if you have any questions, you can always feel free to contact me as well. So I'm going to stop or pause the recording, and then I can take your questions as well.